The COVID-19 pandemic has had an impact on local healthcare facilities and staff. Toma Health Physician Assistant Jerry Fucianis joins us this edition of HealthCheck 360 with an inside look into the effect of the pandemic on local healthcare and staff operations at Toma Health. Welcome, Jerry. Thanks for being with us.
Well, thanks for having me.
I think Mr. Minnie's got your first question.
Does he?
So Jerry, can you tell us a little bit about the role you have at Toma Health as a physician assistant?
Sure. PAs, physician assistants, are part of the healthcare team. Us, as well as nurse practitioners, round out what a provider is. So traditionally, when you go to a hospital or to a healthcare facility, you'll see a physician, an MD or a DO. PAs and nurse practitioners now, and especially in the rural communities, kind of round out that team. We provide services very similar to the physicians. PAs work under the authority of a physician.
Okay.
Jerry, so with COVID and the pandemic, can you just talk us through a little bit, maybe what have been some obstacles for the healthcare, and maybe what have been some, wow, we didn't know that would be such a great thing to come out of COVID. You know, I hear that from people, like we've had to slow down and take, but obstacles or?
Certainly from a healthcare standpoint, we were just so fortunate to get our facility open when we did. Is that the new facility, the extra resources that we have, the extra space that we have is coming into play to help us deliver healthcare in a much better way. Some of the things that we're finding is, just as you mentioned, people working together to try to solve a problem like this. The virus itself, we're learning about every day, but how to deal with it and how to cope with it as individuals has been a real challenge.
So with the virus been going on since, well, almost just before you guys opened, or just after you guys opened up, I should say.
We planned that right.
So so during all that, what do you think you're most proud of in combating that?
I think the thing that we have to be the most proud of is how we're able to deliver care to the numbers that we're seeing. The volume has increased, as you would expect, and that we've been able to keep up with that and provide services to the community, keep our doors open, and take care of just about everything that comes our way.
What would be some suggestions you would have for our viewers to prevent or to combat the COVID? What are, we see masks, but what are other things? I mean, I don't know that our viewers should be really like washing hands. That's such a big one too.
Well, it's the basic things that we talk about with any virus. It would be things like wearing a mask, washing hands, practicing good hygiene. What we add in COVID, because we believe it to be respiratory carried, is going to be things as far as social distancing, trying to keep a distance from others. If you're ill, trying not to expose yourself to others. The challenge with this is, as we learn more and more about it, different populations become affected. So our elderly population, or people with significant comorbidities, are the people who are getting the sickest. So when we ask people to wear masks, or we ask them to follow these basic practices, it's not just to keep them healthy, but it's to keep others in the community and others in their family healthy. So it's a different way of going at it. If we did this for every virus, we'd probably be able to wipe out a lot more. But especially with this one, we find it to be very helpful. That's why our numbers in this area have been stable. Even though they're climbing, we're stable compared to others.
I've also noticed that, I know there's like the hot list items of symptoms, but I've noticed that there's a lot of folks that are coming up with COVID that aren't experiencing those main symptoms, and they're kind of being underlying.
Originally, obviously, we identified fever as one of the primary things, and cough. And while those do still stay on the list, we're seeing other things such as profound fatigue, muscle aches, diarrhea is being reported in a lot of the patients who are presenting in. So things that they wouldn't normally attribute to this virus, we're now starting to see become part of the constellation of symptoms that make out the picture of it.
So do you think that maybe the normal flu season is kind of, maybe people are getting confused? Are they more scared that they have COVID than they have the normal flu?
It's kind of like they're merging, or what's happening there.
Exactly. I mean, it's what the CDC's been talking about for a while, how this will hit at about the same time, and differentiating between the two is going to be very challenging. Locally, we do have a multi-swab test that is able to identify flu A, B, RSV, and COVID in one swab. So I think just this week we started using that, and it's been very effective at helping identify what virus we're looking at.
Jerry, can I ask you, what are you swabbing when you say one swab? Is that the...
Yeah, it's the nasal swab. It's certainly not pleasant or comfortable. I mean, it's doable, and you will survive it, but it's not a pleasant... It goes up pretty far, and it has to twist a bit, but that sample that they get is very, very helpful in identifying the virus.
I've heard it's almost like when you jump in water and you get water up your nose, that's kind of sometimes what it feels like.
Yeah, I guess it would be.
Like, you get that, and then you're like, oh, I got water in my nose.
For about 4 or 5 seconds.
And then you can...
Absolutely.
Go ahead, Joe.
Oh, no, go ahead.
I was going to say, any other suggestions or thoughts about COVID for our viewers before we kind of let you off?
It's making the decisions that are right for you this year, trying to maintain that social distancing, making choices when it comes to the holidays. I mean, with Thanksgiving, with Christmas, we have the desire, we want to be with our families. We very much do, but we have to think about the risk that we're putting people at. Vaccines coming out in a very short amount of time, we'll be through it, but we're still in it right now. We have to stay true to it until probably the spring.